Rocuronium, it is common trade name for it is Zemuron. It is a non-depolarizing neuromuscular blockade and a paralyzing agent. So the way it works, mechanism of action, it antagonizes or blocks the acetylcholine at the motor end plates. And so that way, whenever you block the acetylcholine, it doesn't allow those muscles to fire and therefore produces paralysis. It is different than SUX in that because it's a non-depolarizing, it doesn't usually cause those fasciculations, and where SUX mimics acetylcholine and gets those little muscles to fire off and then prevents them from firing again, Rocuronium just prevents them from firing altogether. And so it produces paralysis on all skeletal muscles, respiratory, causes apnea, all that good stuff. Pregnancy class for it is B. We're using this for RSI. Again, it provides no sedation, no pain control, nothing like that. All it does is paralysis, and so that way you can get your tube introduced and all that ventilation, good stuff like that. Contraindications would be sensitivity to other bromides. It is technically Rocuronium bromide is the label for it. And then we also want to use caution with cardiac and renal failure patients. Just a relative contraindication. Adverse reactions can cause bronchospasm, fairly rare. Apnea, of course, it's going to cause. That's the purpose of it. Dysrhythmias, nausea, vomiting, hypotension, or hypertension. So you could get either one of those, just something to watch for with it. Again, those are pretty minor or rare instances that does happen. So inhaled anesthetics may enhance the effects. If you are given something like lidocaine or some nasal fentanyl, something like that, it can cause some enhanced effects with that. Typical adult dosing, 0.6 to 1.2 milligrams per kilogram. That's going to be the same for the kids. You can give that IV or IO. Onset 1 to 2 minutes usually. Peak effects varies within 5 minutes. It's relatively rapid. A lot of times they say within 90 seconds. Duration is 45 minutes to 2 hours. And the thing with Rocuronium is it is very dose dependent on how quickly it starts working and then how long it stays working. So you look at your 0.6 milligram per kilogram dosage, it might take 2 minutes to fully paralyze somebody and only last in the body 30 to 45 minutes. Whereas if you give that 1.2 milligram dosage, you get the paralysis within 30, 60 seconds, something like that. But it's going to stay for a couple hours, and they're going to be paralyzed for a really long time. So it's always better to go with the lighter dose if possible. Of course, follow your protocols with that. And like with all of these paralyzing agents, you need to be sure to sedate the patient before and after paralyzing them. And kind of one big caution that they have with giving it to EMS providers is that follow-up sedation. We're really good whenever we're getting our RSI stuff out, give them some fentanyl, give them some etomidate, Versed, whatever it is, to sedate them, give them our paralytic, and then we get busy working on other stuff, getting them on the vent, all that other stuff, and remembering to resedate those patients. They can be paralyzed but be fully awake at the same time. And so it is super, super important with Rocuronium Vec, any of those longer acting paralysis agents, that we are sedating them properly and keeping them down. It's very unethical to have somebody who's paralyzed but not sedated. So just be very, very cautious with that and be very liberal with the sedative medications that you have in your toolkit.